My name is Drew Raby. I'm going to be doing a head, ears, eyes, nose, and throat exam on my patient here. I'm going to start off by washing my hands. I already washed my hands before this video. I'm going to gather my equipment. I have it right here. And then I'm going to begin asking Courtney, what is your last name?
Dietrich.
Okay, where are we right now?
We're at my house.
Why are we here?
We're doing your video.
Perfect. And what is the day of the week?
It's Friday.
Perfect. So then I'm going to look at her general appearance. She looks like she is very hygienic, takes showers, her clothes match the weather outside. There's no fraying or anything like that. Then I'm going to just kind of look at her skin, general skin. Looks consistent with her ethnicity. Then I'm just looking at her posture, and she's sitting upright. Posture looks good. And then I'm going to notice her affect. She seems to be calm, cooperative. Mood is happy, I guess. Pleasant, yes. Speech is clear. Her hearing seems to be intact. And nutritional status. Have you had any changes in weight gain or weight loss recently, unexpected?
Nope.
How many meals a day do you eat?
I try for 3.
Try for 3, so 2 to 3. So healthy, average nutritional status. And then we're going to move to the head. I'm just going to look at the appearance of her hair, the hair distribution. There's no brittleness to the hair. Hair is distributed evenly. And then I'm just going to palpate, feeling for any indurations, which I don't feel any. Looking for any lesions if they're visible. And I'm also feeling for any lumps or bumps, which I don't feel any. And then I'm going to move on to her face, looking at her face, seeing if it's symmetrical, which it is. And I am going to feel her pulses, temporal pulses, and they are equal. And then I'm gonna have you open your mouth for me and close, open and close. Just feeling the temporomandibular joint. There wasn't any popping or anything. It was intact. And then I am going to look at her pupils. I guess I could use this. So I'm going to shine a bright light in your eyes. Pupils are about a 4. Pupillary response is reactive. She has consensual pupillary response. I'm also looking at the sclera to see if there's any yellowing, redness. Don't see anything like that. Looking at the iris, and then I'm going to pull your bottom eyelids down. Just looking at the conjunctiva, which looks good. Cornea. Don't see any foreign objects or anything in there. Then I would do a Snellen chart assessment. I would have her stand 20 feet away from the chart and have her read the lowest line that she could while closing one eye. And then I would do the red reflex, where I use a ophthalmic scope, and I'm looking for redness in the retina, like a red-orange color. Also with the eyes, I'm going to test 6 cardinal gazes. So watch my finger, just follow with your eyes. Okay, looks good. Cardinal gazes are intact, and then I'm going to check peripheral vision. Tell me when you can see my fingers.
I can see them.
Okay.
I can see them.
Okay.
I can see them.
Perfect. All right, peripheral vision is intact as well. Okay, now I'm going to assess the nose. If you would block one nostril for me and breathe. Can you breathe? Yep, now do it with the other nostril. Good. All right, so now I am going to shine a light, look in your nose. I'm looking at the turbinates, making sure that they're intact. I'm making sure there's no septal deviation, and I'm looking at the mucosa. So mucosa is pink, turbinates look intact, and there's no deviation. So now I'm going to move on to the ears. I'm going to first, can you put your hair back behind your ears? I'm going to look at the outer structure. I'm looking for any extra drainage or lesions or anything like that. I didn't see any. And then I'm going to whisper a word. If you'll just cover this ear for me. Tell me what word I say. Apple.
Apple.
Okay. Now do it with the other one. Tell me what word I say. Baseball.
Baseball.
Good. All right, so whisper test is complete, and now I am going to look in her ears. We'll put this together real quick. So I'm going to look in her ear, I'm going to pull back and up, and I'm going to shine the light in there. All right, and her tympanic membrane is pearly white. Mucosa looks good. There's no excess drainage, nothing like that. And then I'll look at this ear too. I'm looking for the same thing. I don't see anything like that. Tympanic membrane is pearly white as well. I'm also going to do the tug test. I'm just going to kind of pull on your ears. Tell me if this hurts at all. No? Okay, good. All right, and then I'm going to move to the mouth. I'm going to look at all the mucosa. I'm going to look at her tonsils. I'm going to look at the uvula. I'm going to look at all the mucous membranes, her tongue, the ducts in her mouth, and that's about it. So I'm going to shine the light in your mouth. If you'll open your mouth, say ah, and stick out your tongue. Okay. All right. Tonsils, I'd give a grade of 0. Mucosa is nice pink. Dentition is intact. And I didn't see any lesions. Nothing like that. I was also looking at her lips. Lips aren't cracked. There's no herpetic lesions or anything like that. Then I'm going to move on to the neck. And I'm going to first look at it, look at symmetry. Neck looks symmetrical, trachea is midline. And then I'm going to palpate around your neck. And I'm just feeling the trachea. And then I'm going to palpate her pulses, her carotid pulses. They're equal bilaterally. And then I'm going to palpate her thyroid. I'm going to find the cricoid. And I'm going to have you swallow for me. Okay. And then I'm just palpating the thyroid. It's nice and soft. Okay. I also need to palpate all of her lymph nodes, so I'm just going to palpate around, feeling her lymph nodes. Okay. Is there any pain in your sinuses? I didn't check on that.
Mm-hmm.
Then I am done. Thank you.